Gonorrhea is not a common infection, but it's a fairly miserable thing to get. Hi, I'm Dr. Joe. In years gone by, gonorrhea was much more common than today. It's a sexually transmitted infection. Now, typically it causes pain with passing urine. It can be described as passing razor blades, and it also produces a discharge from the genitals, which will usually be a bright yellow or green colour. It's not a particularly subtle infection. On extremely rare occasions, people may carry it and not have symptoms, but it is quite rare. It is a sexually transmitted infection, so it's something you'll have picked up from somebody, and it can also be passed on to other people. These days, most commonly, if we're going to see it, it may be from people who've travelled overseas, perhaps to Southeast Asia, not exclusively, and obviously people, if they've been having unprotected sex, are at much greater risk than getting it. Condoms don't guarantee that it's impossible, but by gee, they make it a lot less likely. But like going out in the rain with the proverbial umbrella, makes it less likely you get wet. Alrighty, gonorrhea is important to treat. It is a nasty infection in that it causes quite severe symptoms and it is quite contagious and can be passed on. Fortunately, it's fairly easy to diagnose, usually on urine sample or swab, and it's very easy to treat with antibiotics. There are a couple of different forms that are used, some as an oral form. Sometimes it requires an injection of antibiotic. Now, after you've been treated, there'll be a couple of other important things. Number one would be to let anybody that you've been in contact with sexually know, because you don't want to pass it on to them, but also they may have passed it on to you, and it's possible that people might even do that unknowingly. The other important thing will be to do a follow-up test and make sure it's cleared. Now, you'll generally have a pretty good idea of that because the symptoms will go away, and that's a good indicator that it's gone, but you want to make sure it's completely gone, so follow-up testing is recommended. Chlamydia causes similar symptoms, although usually not as severe, and we've got a separate video on that, and non-specific urethritis can also cause similar symptoms to chlamydia. So, gonorrhea. Don't hear a lot about it these days. It's not that prevalent, but it's still there. It is relatively straightforward to treat, so if you have any concerns or suspicions about symptoms, then you do need to be going along to see your doctor, because it can be treated and you don't want to be passing it on to anybody.